Hello guys, how we doing? So somebody sent me a message to my WhatsApp, um, asking me, Mr. John, lately we've seen you talk about Inclex F1 visa since you moved to the US. Don't you do the data flow process anymore? You've been active in the UAE for many years. What is happening? I think that person is not following us so well through our YouTube and seeing what I've been doing. So I decided to make this video just to let you know that we are still very much active in the UAE. Okay, instead, what we're doing, we're just expanding. Okay, we're just expanding our services. So that's why I've been talking about the UAE for many years. So I think most people who know our company, they know what we do in the UAE, and we have videos in the YouTube which you can follow to see what we do. So notwithstanding, I will still give you a rundown of what the UAE healthcare system is all about. So we have three main healthcare boards in the UAE: nursing board, licensing board. We can add for Dubai Healthcare City. It's fine. So you have Dubai Health Authority when you're licensed to work in Dubai. You have Department of Health Abu Dhabi, where you're licensed to work in the Emirate of Abu Dhabi or Al Ain. And you have Ministry of Health and Prevention, where you can work in Sharjah, Ajman, Omakwen, Fujairah, and Ras Al Khaimah. Okay, so these are the seven emirates of the United Arab Emirates. So now, you can be licensed, you can take your exam in either of these boards, and then you transfer, but you need to have an active license in either of the boards in order to transfer. And you need an offer letter, meaning you need an employer to be able to transfer your license from Dubai to Abu Dhabi. Okay, you cannot do that by yourself, or to transfer your license from Sharjah or from MOH to Dubai or to Abu Dhabi. Likewise, so you need to have an active license. So we do all of this. So what are the requirements for nurses and midwives? You need to have done a course of at least a minimum of 18 months, 2 years, or 1 year, 6 months in your home country, and you are licensed. So for you to be licensed in your home country, your course needs to be approved. You need to do from a school that is authorized either by your Ministry of Health or by your Ministry of Education in your home country. Unfortunately, in the UAE, if you have a 3 years diploma, which in any part of the world you are qualified to be a registered nurse, but in the UAE you will either be a practical nurse or assistant nurse. Either of the names is the same thing. They just use those names interchangeably. So for you to become a registered nurse or a registered midwife, you must have a 4 years bachelor degree in nursing. For lab technologies, you must have a bachelor degree. Lab technician, you have a diploma. Okay, so physicians, and the other requirement for physician is that you need to submit an internship, 12 months internship upon graduation. So I see we've come across some countries that they don't have internship, like Cameroon. When you graduate from medical school, you just move on to practice. But in countries like, I think, Ghana, Nigeria, Zimbabwe, I think when you graduate from medical school or nursing school, you do the youth service. That's what the UAE wants you. You need to have that 12 months internship plus at least 3 years experience. So that youth service is not counted as experience. You get it? It's counted. That's for physicians. For nurses, they don't require that youth service certificate. It's nurses and midwife and other professionals, they don't require it. Now, so that is that. Another thing is good news. As of 2022, fresh graduates are not required to submit experience letters. It means if you just graduate, say, less than 2 years ago, you can take the exam and work in the UAE without an experience letter. All we need is your certificate, your transcript, your license, and your good standing without the experience. So that's the good news for nurses and midwives only. Okay, not lab technician, not physician. Nurses and midwife, you can work in the UAE as a fresh graduate. Okay, if you graduate to last month, you can process to work in the UAE. Okay, we don't need to have experience. So that's it. I said, let me make this for you. And in the UAE, you can work in various areas. You can work in the hospital, you can work in clinics, medical centers, you can work in home care, you can work in long-term care, you can work as industrial nurse, mostly male nurses. Wow. recently a female has been recruited to work in as an occupational nurse. I've not seen that in the UAE for my 10 years in the UAE. It's magical, okay? So one of my nurses got a job recently as an industrial nurse. Kudos and good luck for that. So this can also work as a school nurse. These are the various areas you can work in the UAE. So, but if you want to work in a hospital, like what are the areas that have high paying salary, like in the hospital? You should think of having experience in the ICU, in the emergency department, emergency room, labor and delivery. Okay, so if you have enough experience in this unit of the hospital, you can work in the UAE and these areas. In some major hospitals, they pay more than other areas of the hospital. Okay, so I said, let me make this video to you guys real quick, so you don't come to ask me, Mr. John, where have you been? What about the UAE? No, we are still very much active in the UAE. Please share this video, comment, please like our YouTube channel. We are very much active, okay? Share to somebody, and we will give you enough information so that you can take good decision, okay? I love you guys. See you in my next video.